Hi, hello everyone. In the previous episode, we have discussed what is pathology and what are all the branches of pathology. In this video, we will discuss the various aspects of pathology. What should we know about a disease? First, we should know what do you mean by the disease? That is definition. Then epidemiology, where and when it is happening. Next, etiology, what is the cause of the disease? Next, what is the evolution of the disease, that is pathogenesis, and what are the structural changes that are happening in a cell or a tissue, that is morphology, and because of this, what are the functional consequences that are going to be happen. With all this, your pathology of the disease will complete. After that, management of the disease, prognosis of the disease, and prevention of the disease can be known. Cellular basis of disease concept was given by Rudolf Virchow, who is the father of modern pathology. All diseases start with a molecular or structural alteration in the cell. We begin pathology by studying the causes, mechanisms, morphological and biochemical correlates of the cell injury, because all organ injuries and ultimately all the clinical diseases arise from the rearrangements in cell structure and function. Aspects of pathology. First one is etiology, knowing the cause of the disease. Second one is pathogenesis, the biochemical and molecular mechanisms of its development. And third aspect is morphological changes, that is the structural alterations induced in the cells and organs of the body. Fourth aspect is clinical manifestations, the functional alterations and clinical consequences of the morphological changes. Etiology. As I said earlier, it is the study of the cause of the disease. An etiological agent is the factor responsible for lesions or a disease state. The etiological agent can be bacteria or virus or any other factor. Predisposing causes of the disease. Factors which make an individual more susceptible to a disease, like damp weather, poor ventilation, etc. Exciting causes of the disease. Factors which are directly responsible for the disease, like hypoxia, chemical agents, etc. Now coming to pathology. Study of pathogenesis is one of the main domains of pathology. It refers to the sequence of biochemical, molecular, and cellular events in response to the etiological agent, from the initial stimulus that has been given to the ultimate expression, that is morphological and clinical manifestations of the disease. Examples of pathogenesis like inflammation, degeneration, neoplasms, immune response. Develop in late or incubation periods. Carcinogenesis may happen in years. Infections may be from days to weeks. Morphological changes refers to the structural alterations in the cells or tissues that are either characteristic of the disease or diagnostic of the etiological process. The study of these morphological changes remains an integral part of the diagnostic pathology. Gross examination of the specimen, including the size, shape, weight, color, consistency, and cut surface, and the microscopic examination, histopathological and cytological findings are mainstays of the morphological study. Recent advances in newer molecular technologies like analysis of protein expression, genetic alterations, next generation sequencing are being used to predict the behavior of tumor and response to the therapy. The morphological changes can be, they can be space occupying lesions or depositions or abnormally sited tissues, loss of healthy tissue, obstruction, distension, or rupture. In the gross examination of a mature cystic teratoma of ovary, shown in the picture, grossly, the cystic cavity is filled with pultaceous material. Hair and tooth-like structures in the wall can be observed. On the microscopic examination of this mature cystic teratoma of the ovary, you can find the cellular elements derived from all the germinal layers, stratified squamous epithelium with cartilaginous and thyroid tissue in the subepithelial tissue under the microscopy. Pathologic anatomy. The morphological changes in cell and tissue structure may either be characteristic or suggestive of the disease process in question, or they may be diagnostic of the disease, in which case we can say that they are pathognomonic. Functional derangements and clinical manifestations. The nature of the morphological changes and their distribution in different organs or tissues influence the normal function and determine the clinical features like symptoms and signs and the disease course and prognosis. Now, what is symptom? It is the subjective sign of the disease. That is what the patient complains, like chest pain, dizziness, loss of appetite, weakness, numbness, headache, toothache, etc. That's why history taking is very important, and it is an art. Sign, objective symptoms of the disease. That is, the things or the signs of the disease that are being elicited by a doctor with the subjective signs of the disease or complaints given by the patient, like ascites, cachexia, gynecomastia, hemoptysis, hepatomegaly, splenomegaly, icterus, lymphadenopathy, palmar erythema. All these can be elicited by a doctor. Other clinical manifestations like pain, fever, nausea, malaise, bowel movements, swellings, breathing alterations, skin rash, for your knowledge. Complications and sequelae of a disease. Infections spread to different organs or other areas of the body, and the tumors will metastasize to other organs or they can be locally spread. Long lasting damage may result. Example, nervous damage leading to paralysis and behavioral changes. Now, coming to prognosis of a disease. What is prognosis? It is the fate of the patient. A good prognosis indicates little or no lasting effects, whereas a bad prognosis indicates detrimental effects as a consequence. Earlier diagnosis can improve patient prognosis. Screening, fast diagnosis, healthier in general. Now, coming to epidemiology of a disease. It is the scope of the disease across a population, the morbidity and mortality. Epidemiological studies provide the etiological clues, planning on preventative procedures, and research into the field of the disease. In the picture, you can see how a smoking will lead to a lung cancer or metastasize to bone and some other examples. Course of a disease. So, first, there should be exposure to a pathogen, and based on it, there will be biological onset of the disease. From then, there will be appearance of the symptoms. Till the appearance of symptoms, it is called as preclinical phase. From the symptoms appear to the diagnosis, it is clinical phase, which also includes therapy given. And the final outcome, cured, living with the disease, or deteriorated, or died. In between the diagnosis and outcome, there is a possible relapse and change in therapy also. So this all comes under course of a disease. So when we are discussing about the disease, we should be thorough with some nomenclature. Now we will discuss few nomenclatures of a disease. Congenital. The name itself is saying it is caused during fetal development. It can be a genetic or non-genetic. Acquired, that is, it is gained throughout an individual life. Now, primary, wherever the name primary itself says that is the cause, is there is no evident cause. Stage is initial stage or initial site, primary. Secondary, cause, complication or manifestation of some underlying lesion, and the stage, subsequent events. It can be metastasize or metastasis. Now coming to acute, with this it means rapid in onset, often with rapid resolution. Chronic means insidious onset, which lasts for a prolonged period of time. Benign means localized, whereas malignant is related to spread. Few prefixes that are being used in pathology for the disease. Wherever the prefix ana comes, it means back or again or up. Example, anaplasia. Dis means bad, difficult, defective, abnormal. Example, dysplasia. Hyper, that is excessive. Hypertension, hyperglycemia. Hypo, it is deficient. Examples, hypotension, hypoglycemia. Meta means after or beyond or change. Example, metaplasia. Neo, neo means new, new growth. New growth. Now we will discuss few disease suffixes. Itis, that is inflammation or arthritis. Okay. Homa, that is tumor or mass. Example, teratoma. Oocyst, condition or abnormal condition. Example, diabetic ketoacidosis, metabolic acidosis, respiratory acidosis. Okay. Oid, resemblance, rheumatoid arthritis. Okay. Penia, lack of or deficiency, thrombocytopenia, that is decreased platelet count. Cytosis, increased number of cells. Leukocytosis. Ectasis means dilatation, bronchiectasis. Plasia, disorder of growth. Hyperplasia, dysplasia, anaplasia. Okay. Opathy, abnormal state. Neuropathy, retinopathy. Eponym, if we are using a scientist name or a place name to an entity or a disease, then it is called as eponym. Example, Bombay blood group, Alzheimer's disease, Hodgkin's disease, Down syndrome, Turner syndrome, Ewing sarcoma. Some techniques in pathology. Gross examination is macropathology. Light microscopy is histopathology. Histochemistry is study of the chemistry of the tissues, immunofluorescence and immunohistochemistry. Biochemical techniques, cell culture, electron microscopy, and molecular techniques. So, etiology is why, pathology, pathogenesis is how, morphology is what is wrong, lesion what is going to happen, diagnosis what can be done, prognosis what should be done. Aspects of disease process. Summary. Etiology is cause. Pathogenesis is mechanism of the development of the disease. Morphological changes is pathological anatomy. Functional derangements and clinical significance indicate symptoms and signs. Complications and sequelae. Prognosis is outcome with and without therapy. And epidemiology. These are the aspects that have been discussed in this video. For your exercise, just test yourself. What is pathology or define pathology? What could be the etiological cause of a liver disease? If someone stated that they are suffering with hyperkalemia, assuming you don't know what this disease is, and based on the nomenclature of the disease, what do you think hyperkalemia is referring to? Please comment to these answers in my YouTube channel, Dr. Ravichandra Official. Thank you. Like, share, and subscribe Dr. Ravichandra Official.